Hey everyone, welcome back to another video. In this video, we're going to be talking about cognitive behavioral therapy, also known as CBT. Cognitive behavioral therapy is one of the most common forms of therapy that's used today, and there's many reasons for this. So stay tuned and let's jump right in. First off, what is CBT? CBT is a structured, goal-oriented type of psychotherapy that aims to identify and then modify negative thought patterns, beliefs and behaviors that contribute to emotional distress. It's based on the idea that our thoughts, feelings and behaviors all interact and influence each other. So by changing our thoughts, we can change how we feel and act. Now, CBT is considered to be an evidence-based therapy, meaning that its effectiveness has been supported by lots and lots of research studies. Now, CBT is usually short-term, lasting anywhere from 6 to 20 sessions, although sometimes it can be longer depending on the person's needs. It's typically time-limited with clearly defined goals, and it encourages active participation and collaboration between the therapist and the client. The ultimate goal is to teach the client skills that they can use independently to manage their own emotions and behaviors long after therapy ends. Now, here are some of the core principles of CBT. First off is the cognitive model. This is the idea that our thoughts, feelings, and behaviors are all interconnected and influence one another. CBT is based on the idea that our thoughts have a direct impact on how we feel. So for example, if you believe that you must always be perfect, then any mistake that you make would cause you to feel anxious or guilty or inadequate. So the core principle is that if you challenge your belief that you must always be perfect and maybe reframe it to be more flexible, realistic, then you'll likely feel less anxious about making mistakes. Another core principle of CBT is collaboration and active participation. So CBT isn't a one-person show. It really involves the client and the therapist working together to figure out what the problems are and what solutions might look like. The client is encouraged to ask questions and to really collaborate with the therapist in setting goals and deciding on what strategies to use. Another core principle of CBT is that it's structured and time-limited. So as I mentioned earlier, CBT is usually short-term, lasting about 6 to 20 sessions. Now this can vary depending on the person's needs, but generally CBT has a beginning, middle, and end. There are goals that are set and those goals are worked towards. The sessions are usually structured and there's usually a specific agenda that's followed. Another key principle of CBT is skill building. So CBT teaches the client concrete skills that they can use to manage their emotions and behaviors. These are skills that they can use even when the therapist isn't there anymore. So some examples of these skills include cognitive restructuring, which is the ability to identify and then challenge negative thoughts, as well as behavioral activation, which is the ability to engage in activities that bring you joy. Now let's talk about some of the key techniques used in CBT. First off is cognitive restructuring. This is one of the most well-known techniques used in CBT, and it involves identifying and then challenging negative thoughts or distortions in thinking. Now these could be automatic thoughts that just pop into your head, or they could be beliefs that you hold about yourself or the world. For example, someone might have a belief that says something like, I must be perfect, or people should always do what I want them to do. These beliefs can lead to negative emotions like anxiety or depression. So cognitive restructuring helps the person identify these thoughts and then challenge whether or not they're really true and whether or not they're helpful. So for example, someone who believes I must be perfect could learn to reframe their thoughts to be more flexible and realistic. So instead of saying I must be perfect, they might say it's okay if I make mistakes. Everyone does. I can learn from them. Another technique used in CBT is behavioral activation. This is especially helpful for people who are struggling with depression or who tend to avoid things that make them feel uncomfortable. Behavioral activation encourages the person to engage in activities that bring them joy or that are meaningful to them. It's about taking action despite how you feel, because sometimes when you feel depressed, you feel kind of numb or unmotivated and you withdraw from the things that you usually enjoy. So behavioral activation helps you break that cycle. Another technique used in CBT is exposure therapy. Now this one is particularly helpful for people who struggle with fears or phobias. Exposure therapy is a type of behavioral therapy that involves gradual confrontation of the thing that you fear. For example, if you have a fear of dogs, you might start by looking at pictures of dogs and then maybe progress to seeing dogs in person from a safe distance, and eventually you might pet a dog. The goal is to reduce avoidance and to decrease the fear response over time. Exposure therapy is also used in trauma-focused CBT, which is used for people who have experienced a traumatic event. Another technique used in CBT is mindfulness and relaxation techniques. So some examples include deep breathing exercises or progressive muscle relaxation. These are techniques that can help calm the body and the mind, and they can be used in response to anxiety or stress. Another technique used in CBT is problem-solving training. This is a technique that's used to help people break down problems into smaller, more manageable steps. It's especially useful for people who struggle with feeling overwhelmed or who get stuck in negative thinking. Now let's talk about what CBT can treat. CBT has been shown to be effective for a wide range of mental health conditions. Some examples include depression, anxiety disorders like generalized anxiety, panic disorder and social anxiety, obsessive-compulsive disorder, PTSD, eating disorders like bulimia and binge eating disorder, insomnia, chronic pain, and substance abuse. Now, here are some of the advantages of CBT. First off, it's supported by extensive research. In fact, studies have found that CBT is often just as effective as medication for disorders like depression and anxiety. Another advantage of CBT is that it focuses on relapse prevention. CBT teaches the client skills that they can use for the rest of their life to manage their emotions and behaviors. So even after therapy ends, the client can continue to use these skills. Another advantage of CBT is that it's collaborative. CBT involves the client and therapists working together as a team. The client is an active participant in therapy and is encouraged to ask questions and to really be involved in the process. Now, here are some disadvantages of CBT. First off, CBT requires commitment. CBT often involves doing things outside of therapy sessions, such as completing thought records or practicing relaxation techniques. It can be challenging for some people to do this. Another disadvantage of CBT is that it may not be appropriate for everyone. For example, CBT may not be the best option for people who are dealing with deeper psychological issues or systemic problems. For example, some people may benefit more from psychodynamic therapy, which explores unconscious processes and past experiences. Now, there are many variations of CBT. Here are just two examples. Dialectical behavior therapy, also known as DBT, is a type of CBT that was developed to treat borderline personality disorder. DBT includes the elements of CBT, but it also adds in emotion regulation skills, distress tolerance skills, and interpersonal effectiveness skills. Another variation of CBT is acceptance and commitment therapy, also known as ACT. ACT is a type of CBT that focuses on accepting thoughts rather than challenging them. ACT encourages the client to focus on what they value and to take action in line with those values. Alright, so that wraps up this overview of cognitive behavioral therapy. If you liked this video, please give us a thumbs up. Thanks for watching and see you next time.